Assalamualaikum and hi, Teacher Aisyah here. So today I will be presenting on Echolalia. First and foremostly, we will be going on through what is Echolalia, which is also known as echophrasia. Echolalia was the term that the word is derived from the Greek roots, which is echo means to repeat and lalia means speech. Repetition or echoing of words or sounds that you hear someone else say. Echolalia to the unsolicited repetition of utterance made by others. In simple way, echolalia was a non-voluntary repetition of another individual's speech. It is one of the most common echo phenomena and is a non-voluntary, automatic and effortless pervasive behavior. Echolalia is a normal finding during language development in toddlers. Symptoms are repeating phrase, words or noises that you hear others say is the main symptoms of echolalia. It can also cause anxiety, irritability or frustration while talking to someone. So, what are the causes of echolalia? In children, children often learn to speak by repeating words that they hear. Echolalia in children commonly seen in toddlers during the first 3 years and can be a problem if it continues in children older than 3 years old. Echolalia is a sign of autism, developmental disability, or communication disability in children over the age 3 years old. It can happen in children with autism spectrum disorders like Asperger's syndrome. They may need extra time to process the world around them and what people say to them. This causes them to copy or repeat the sounds or words they hear. In adult, you may find yourself repeating the same words you hear in a stressful situation, but you may also have echolalia with neurological or psychiatric problems, including language disorders like aphasia, head injury or trauma, neurodegenerative disorders, confusion or delirium, memory loss or dementia, brain tissue inflammation or encephalitis, Tourette syndrome, learning disability, paralysis, schizophrenia, or stroke. There are two major types of echolalia, which is immediate echolalia, which refers to the repetition of speech immediately after the utterance. Secondly, delayed echolalia, which refers to the repetition of speech sometime after the utterance. Historically, echolalia was described as a meaningless speech disorder. However, recent literature suggests that echolalia may have a communicative function. Both immediate and delayed echolalia can be communicative, which is repetition with an apparent meaningful or communicative purpose, or semi-communicative, which is repetition with no clear communicative purpose. Echolalia too can be classified based on the features of speech repetition, which is unmitigated echolalia. This refers to verbatim or exact repetition of speech, and mitigated echolalia. This refers to repetition of speech in altered form. As language and comprehension improve in children with autism, more mitigated echolalia may be observed. The child learns to make a change in the speech or intonation instead of repeating verbatim. Mitigated echolalia may have a higher functional category. Echolalia can be classified based on the nature of the stimulus. The speech repetition can be person-directed or non-person directed, which is ambient echolalia, refers to the repetition of words or sentences from the environment. For example, from television, bike, car, or fan. Then, echoing approval, which is refers to the situation where patients echo in positive or negative intonations, replying to questions instead of repeating the whole part of sentence. Sometimes, they may respond to questions that were not addressed to them. Echolalia was a form of imitation, is a useful component of language acquisition. Echolalia is common in toddlers as they learn to speak. Echolalia becomes less and less prominent as language skills develop. A disorder may be suspected if automatic speech imitation persists or re-emerge after the age of 3. March Blunt, which is a clinical speech-language pathologist, proposed 6 stages of natural language development for childhood autism, which is on stage 1 was unmitigated echolalia for the use of whole language gestalt. For example, let's get out of here, want some more, are you okay? Stage 2 was mitigated echolalia or altering the gestalt into synthetic units and recombining the units. For example, one out of here. For stage 3, isolation of single words. Mix and match of single words, generating two words phrases. For example, get more or one out. For stage 4, generation of a first simple sentence. For example, I get out. Stage 5 was a generation of complex sentence with grammar. For example, I want to get out. And the last stage, which is stage 6, generation of more complex sentence with advanced grammar. For example, how long do you want to play outside? Several tools have been studied for quantifying the repeats in children with echolalia. So, what are the differential diagnoses of echolalia? Echolalia is one of the most common ecophenomena and is a non-voluntary, automatic, and effortless pervasive behavior. Other examples of ecophenomena was echopraxia, the involuntary repetition of movements, echolalioplastia, repetitive sign language, ecomimia, imitative facial actions, echographia, written repetition of speech, coprolalia, automatic repetition of obscene and socially inappropriate words, clausomania, compulsive shouting, palilia, repetition of one's own words. Echolalia is a heterogeneous symptom seen in various pathological states which must be differentiated. So, what are the treatments for echolalia? Treatment of echolalia depends on the etiology. The management of echolalia related to autism requires a multidisciplinary team including parents, neurodevelopmental specialists, therapists, psychologists, and special educators. The key to managing echolalia in children is to know the reason for speech repetition, the meaning behind the repetition, and responding in a manner to help the child learn to communicate. Observing, listening, and waiting during the child's interaction and talking helps gather message behind the echolalic speech. While interpreting the child's echolalia, the ideal response is to say it exactly how the child would if he or she could. Okay, one of the treatment of echolalia was speech-language pathologies. Applied behavior analytic interventions for echolalia in ASD include cues, pause, pound training, script training, visual cues, gestalt learning, verbal modeling, self-monitoring training, differential reinforcement of lower rates of behavior, and positive reinforcement for appropriate response. Echolalia related to aphasia include interventions like constraint-induced aphasia therapy, while music therapy has also been incorporated into the assessment and treatment of echolalia. Another treatment was pharmacotherapy, which is may be indicated in older children where the echolalia is triggered by stress and anxiety. Selective serotonin reuptake inhibitors have been used in echolalia secondary to stroke. Echolalia is one of the most common ecophenomena and is a non-voluntary, automatic, and effortless pervasive behavior. Other examples of ecophenomena include echopraxia, the involuntary repetition of movements, echolalioplastia, repetitive sign language, ecomimia, imitative facial actions, echographia, written repetition of speech, coprolalia, automatic repetition of obscene and socially inappropriate words, clausomania, compulsive shouting, and palilia, repetition of one's own words. Echolalia is a heterogeneous symptom seen in various pathological states which must be differentiated. In autism spectrum disorder or ASD, which is recent studies have shown that echolalia is a coping mechanism for children with autism to communicate when they cannot produce spontaneous speech and have reported echolalia as evidence of gestalt processing in children with ASD to acquire language. ASD are a group of pervasive neurodevelopmental disorders characterized by impaired social functioning, communication, and restricted repetitive behaviors. It usually manifests before 3 years of age, and there is a wide variation in severity of clinical presentation. While in Gilles-de la Tourette syndrome, which is in simple way Tourette syndrome (TS), is a childhood onset neurodevelopmental disorder characterized by vocal and motor tics. Echolalia, coprolalia, and echopraxia are some features of TS. Motor tics present in TS include jerks, twitch, and tics. The disorder has a wide range of severity and is associated with other behavioral and psychiatric disorders. TS, if, TS is often associated with attention deficit hyperactivity disorder, which is ADHD, and obsessive compulsive disorder, which is OCD. Tourette syndrome has a waxing and waning course. Cognitive behavioral therapy is the first-line treatment for TS. Pharmacotherapy too is used if behavioral therapy alone does not work. Medication like clonidine, risperidone, fluoxetine have been used in Tourette syndrome. Lastly, in stroke, which is in adult patients, echolalia after stroke is seen in transcortical motor aphasia. Positron emission tomography scans can show increased uptake in frontal, temporal, and parietal lobes. Okay, so that's all from me on echolalia. Thank you for listening.